Hi, I'm Dr. Elizabeth Friedman. I'm a physician. I work as the Medical Director of Environmental Health at Children's Mercy in Kansas City, and I'm also the Director of the Region 7 Pediatric Environmental Health Specialty Unit. Our programs are affiliated with the University of Missouri in Kansas City and the University of Kansas. And welcome to this video, Healthy Schools, Improving Indoor Air Quality and Environmental Health for Better Student and Staff Outcomes. This talk was brought to you by the Mid-America Pediatric Environmental Health Specialty Unit. Pediatric Environmental Health Specialty Units, or PACEUs, are a federally funded network of pediatric environmental health specialists based at academic medical centers across the United States, with expertise in the prevention, diagnosis, management, and treatment of health issues that arise from environmental exposures from preconception through adolescence. The Region 7 PACEU, or the Mid-America PACEU, serves Missouri, Kansas, Nebraska, and Iowa. At the MAPEHSU, we work together to provide consultations, referrals, outreach, and education on environmental health topics in our region. One of the subject matters the MAPEHSU spends a lot of time on, especially lately, is indoor air quality, and that's in part due to the work we've been doing with the Children's Mercy Healthy Schools and Early Child Care Centers team. You can learn more about our specific PACEU by going to our website. Today, our goal is to provide information on improving indoor air quality in schools. This topic has gained a lot of attention since the COVID-19 pandemic began. The pandemic has really challenged the way we interact in group settings, especially where children are involved. As such, we will begin this presentation discussing the transmission and progress on the COVID-19 front. Then we'll discuss sources of contamination, impacts on air quality, and best practices for healthier indoor air in schools, and therefore healthy students. We'll also share some tools and resources we've made available for school staff and others involved in building and environmental management to help promote healthy schools. The presentation is primarily going to focus on improving indoor air quality, strengthening environmental controls, healthy buildings, and benefits to students and staff. Our objectives are to inform you, the audience, on transmission and spreading of airborne particles and infectious particles like the coronavirus, to describe best practices for healthy indoor air quality and environmental health, and to provide tools and resources to promote healthy schools. The talk is intended for school administrators, facility managers, custodial staff, supply purchasers, teachers, school nurses, and others who are involved in building and environmental management. Although many of you have become familiar with the coronavirus, I'm just going to give a small overview. SARS-CoV-2 is a small virus, about 0.12 micrometers in size, and it is primarily spread through droplets and aerosols in the air. The spread of particles depend on how the droplets enter the air. That is, if the person who's infected is breathing, talking, singing, coughing, or sneezing. Those droplets will remain in the air for a period of time, and then they'll settle on a surface, like this one here. It's important to remember that disease spread is less likely to happen from touching a surface than it is from sharing air with an infected person. That said, healthy building practices are still quite paramount in reducing the spread of the coronavirus and promoting health. We have made some substantial progress in how we deal with the coronavirus pandemic. The disease hasn't been eradicated, but we now have vaccinations in this country available for adults and children ages 12 and older. The number of deaths continue to decline, and our positivity rates in many areas, although not all, are improving. There's still a lot of unknowns, though. We don't know how long vaccines are going to be effective, and we don't know if they're going to be effective against all of the variants that continue to arise. So again, layered prevention and precautions are still prudent, and we can take some of those using healthy schools practices. As most of the audience knows, schools are a major influence in children's lives and health. In an 8,000-hour year, kids prior to COVID would spend about 1,000 hours of their time in school. Given that a large chunk of their time is spent in the school building, those of us responsible for them should be mindful of their unique vulnerabilities. There are many, and I'm just going to mention a few. So children are physiologically vulnerable. That means they have different physiology than adults. For example, because their organs are still growing and developing, certain chemical exposures can have more impactful or more lasting effects than the same exposure would have on an adult. Children have a higher respiratory rate than adults, meaning they breathe faster and more than adults do. So in the same room, with the same contamination, at the same breathing level, which is right here, a child would effectively get a higher dose of that contaminant than would an adult sitting right next to them. Children are also socially vulnerable. They don't have the same decision-making power that adults have. They rarely have an option to simply walk out of a room when they're in school without negative repercussions. So again, it's the adult's responsibility to ensure the safest learning environment possible. Since the COVID pandemic, schools are being even more challenged to ensure their students have safe learning environments. Beyond the basic recommendations from the CDC for frequent hand washing, social distancing, and proper masking, schools have been able to address limiting disease spread by improving the following. Improving indoor air quality by upgrading or improving their standard of practice in their ventilation systems, especially in their HVAC systems. This is one way, and we'll talk about this. Ensuring safe and effective cleaning and disinfecting practices is another way, and we'll talk about that as well. Using technology that is supported by strong evidence, we'll touch on that. And also making sure that as these changes are made, that they're also assessed to ensure that the improvements are actually happening, so monitoring of quality improvement. Indoor air quality refers to the air quality within and around buildings and structures and tends to be referenced when we're talking about the health and comfort of building occupants, so students and teachers and staff. Understanding and controlling common pollutants indoors can help reduce the risk of health concerns in both the present time and in the future. Air quality within buildings for those of us in more modern buildings can be adjusted with ventilation for health and comfort. Indoor air quality is also influenced by other factors, including the outdoor air, temperature, and humidity. The activities going on inside the building and also the other people in the room affect indoor air quality. So you can think about that in the context of sharing a room or a closed space with someone who has a respiratory infection like COVID-19. Certainly, their presence affects indoor air quality. Another factor that we often don't think about is the structure itself, or what the building is made of. That too influences indoor air quality. So what's in our air? On the left side of your screen, you'll see a list of pollutants and sources of pollutants. I have included this list not for you to know them, but to give you some perspective for today's presentation. What I want you to see is that there are many contaminants in the air we breathe, or in this case, the air our children breathe. It's not necessary that you understand the toxicology or the medical implications of each of these chemicals or exposures, but as leaders of schools, what we hope you will learn today is a bit about where the contaminants come from and, more importantly, how we manage them. While many sources or factors contribute to indoor air quality, there are some key tools and practices we use to maintain healthy indoor air quality. Those are increasing outdoor air ventilation, meaning bringing in more fresh air, upgrading HVAC systems, providing supplemental air cleaning devices, using safer cleaning and disinfecting practices and products, and using other technology. And that's what I'm going to talk about. Heating, ventilation, and air conditioning systems, or HVAC systems, play a major role in improving indoor air quality. These systems maintain temperature and humidity. They can dilute the concentration of particulates in the air, and they filter the air and remove particulates. Filtration is probably the most common method of air cleaning we use in this country. In the United States, the American Society of Heating, Refrigerating, and Air Conditioning Engineers, or ASHRAE, is currently the authoritative body on proper HVAC use and maintenance. Throughout the pandemic, our team has made rather consistent recommendations for school administrators and their facilities teams. Those are listed on the next few slides for your convenience. Overall, the goals should be to increase the flow of outdoor air, run the system to maximize air exchange, meaning inside and outside air, and to maintain the temperature and relative humidity to reduce contaminants. Maintenance should be driven by need and, we can be honest here, capacity. One point I'll make, and this is important, is to remind you to review your system specifications and to consult with an HVAC licensed professional prior to making enhancements or changes or even the investments. Here are some more of our recommendations, and we encourage you to read them and reference them as you need. And here are some additional ventilation recommendations beyond HVAC systems. Exhaust fans should operate continuously, especially in kitchens, lavatories, and similar areas. And this is to expel indoor air directly to the outside, away from people and animals. Similarly, it helps to keep ventilation exchanges clear of clutter and other blockages, meaning when you have a vent, don't put a whole bunch of stuff in front of it. We want it to be open so that it functions well. In poorly ventilated areas or areas without mechanical ventilation, opening windows and fans can be used depending on the system, the weather, and other safety issues. Of note, fans should not blow directly towards occupants. Also, in areas where aerosols are being generated, like sick rooms or music rooms, these may require some additional precautions. While some technology is proving to be protective, such as portable air filters, like the one featured here, or touchless systems, the real-world conditions efficiencies are still being determined. In other words, we don't know how effective many of these are. The research simply isn't there. Some of these devices, not featured here, actually can cause more harm than good. For example, if ozone is produced. So sound investments in health should be based on evidence-supported strategies. If you're not sure what the evidence is, ask. In-room filters, like the one featured here, have been shown to effectively remove particulate in the air by increasing airflow and then filtering out the particulate. And some authorities are encouraging the use of these portable HEPA filters, again, like the one in this image, in high-risk areas like nurse's office, music rooms where children are singing or playing horns. These machines will, again, circulate the air, and then with the filters, they'll remove the air particulate. And that air particulate will collect on the surfaces of the filters in these machines, and thereby reducing the particulate in the room. Again, if these are being used, the person responsible for cleaning and changing the filters in this machine needs to be trained and also needs to use protective equipment to perform this maintenance. Air cleaner brands will list the contaminants they're effective against. For example, fire smoke, dust, pollen, and you want to look for devices that list viruses. Also, note that the size of the room will determine the size of the device or number of devices. Make sure the square footage of the space of concern is taken into account. So now we're going to talk about cleaning and disinfecting practices. First, we're going to review some keywords. Cleaning is the physical removal of dirt and debris. Disinfection or disinfecting refers to killing germs. Disinfecting should be done with the appropriate chemical, a chemical that has been proven to destroy the microbe of concern, in this case, coronavirus. Specific chemicals have been proven to be effective against the coronavirus. Another popular line during the pandemic is advising folks to clean before disinfecting. If you've got a grimy surface with food or glue or eraser dust, and you spray that disinfectant on it and then wipe everything off, we don't know that you're actually going to be disinfecting the surface that's being used because that chemical's being mixed with all that other stuff. So clean first, then disinfect. Contact time or dwell time is the amount of time that a surface needs to remain wet in order for the germs to be destroyed. If this part of the instructions is not followed, the surface will not be disinfected. Concentration here refers to the amount of product being used when it's diluted, usually with water. And rinsing, even if it's not advised by a product label, is important because it reduces exposure to remaining chemical residues that could be harmful to children. Think about spraying a chemical on this table that will settle on the table, and sometimes contaminants are left behind. And that residue could be risky to kids. So that's why we want to rinse. And rinsing is best done with a clean towel and water. I want to take a moment here to remind you that while we clean to make our environment safer, cleaning isn't necessarily a safe process. In fact, those who do cleaning work professionally have the highest rates of work-related asthma. In other words, cleaning staff have a risk not only of asthma exacerbations at work, but of developing asthma because of the chemicals they work with. Bleach is one of these riskier chemicals. Similarly, children exposed in infancy to more cleaning chemicals are also more likely to develop asthma during childhood. Here are some of the more common cleaners and disinfectants that we use. And this is just sort of bring the conversation back to what's familiar. We use bleach a lot. Bleach is known to be caustic. It is known to correlate with asthma and have other adverse effects. So we want people using it to be careful and safe. Quaternary ammonium compounds, similarly, are used commonly. These are also caustic. These are also correlated with asthma. Additionally, some studies have begun to show reproductive toxicity relating to exposure to quats. Hydrogen peroxide is a chemical we don't talk about often in cleaning, and we often think of it as benign, but it too is not without risk. So we have all of these chemicals and risks, but we still need to clean. What do we do? The EPA has a program called Design for the Environment Antimicrobial Program, and that's featured on the left side of your screen. Using this tool, you can get a list of disinfectant products that are safer for human health and the environment. Some of the lesser toxic cleaning chemicals or disinfecting chemicals include citric acid, hydrogen peroxide, and some of the more toxic chemicals on this list include bleach and quaternary ammonium compounds. The EPA also developed the N list at the beginning of the pandemic. The N list can be used to identify chemicals that are registered with the EPA that are also known to have efficacy against the human coronavirus. Now, if a chemical is not on the N list, it may still have activity against the coronavirus, but they're simply not registered with the EPA. Okay, so now you have an idea of how to figure out which chemicals you may want to use in certain situations. There are some other factors to consider. All right, some of those factors, although not all, are listed here. It is important for anyone doing cleaning to have proper training, and they should be reviewing their training with a regular schedule. Staff should always take the necessary precautions when cleaning and disinfecting or simply using those products. Safety data sheets and the phone number to poison control should also be made available. They should have access to proper PPE or personal protective equipment that can help prevent chemical exposure. Making safety data sheets and proper PPE available is not only ethically the right thing to do, but it's also a legal responsibility of employers under OSHA's right to know requirements. For those of you who are administrators, the EPA has developed a framework for effective school indoor air quality management that could also provide a good launching point if you're just getting started or looking to develop a stronger indoor air quality management program. In this slide, we have featured a few resources we want our audience to be aware of. These resources can be found on the MAPEHSU website as well. To begin with, the CDC continues to be the primary authority of public health practices during the pandemic. ASHRAE is also an authority on HVAC systems, which we've discussed, and we've included their website as well. As I mentioned before, the MAPEHSU website has an abundance of references and resources. A couple are featured in this slide. One that I'd like to mention is our frequently asked questions document. In it, we have featured nearly all of the questions that schools have asked us in the past year, with answers provided by environmental hygienists and healthcare professionals. You can simply open it up, press Control F, and search for your subject of interest. On this slide, contents of which you can find on our MAPEHSU website, are features of healthy building practices. Much of this was taken from Harvard's Healthy Buildings program, and we did add some of our own information as well. Components of a healthy building offers layers of protection, right? The standard practices around maintaining a healthy building are listed here. We've heard hand washing many times, and I'll say it again. Hand washing should be done frequently with soap and water for at least 20 seconds. If hand washing is not a possibility, although it is not a replacement, using alcohol-based hand sanitizer with at least 60% or more alcohol is a good backup. Personal protective equipment, or PPE, is another important practice. Masks should be worn when entering a building, in common areas, when taking elevators. Wearing a mask protects both the wearer and others in the room. And again, because we're talking about children, many of whom are not vaccinated, mask wearing is still of utmost importance. Distancing, as the CDC recommends, is also still important. We can promote distancing by providing staggered schedules, establishing groups or pods, and using physical barriers like plexiglass to reduce particulate spread. Cleaning and disinfection. We've talked about this. Each school should have a protocol that defines when, where, and how often cleaning and disinfecting happens. Anyone doing those practices should be properly trained and have repeat training over time. Heating, ventilation, and air conditioning systems, or HVAC systems, for those of us who are privileged to be in buildings with these systems, should be maintained and upgraded as permissible. HVAC systems provide fresh air, ventilation, temperature, and humidity control. Other technology you may be considering these days could include portable air filters and other new technologies like touchless entryways, elevators, and lavatories. Remember, some of the technology not discussed here may be available, but that doesn't mean you need it or that it makes the environment safer. Minimizing exposure is another practice to consider. This could come in the form of virtual classes, but also in the implementation of one-way entryways and exits. We've also discussed structural and environmental controls today. This involves running exhaust fans continuously, reducing dust and pests, ensuring moisture control, limiting outdoor pollutants from entering the indoor air, and taking general health and safety measures. Improving indoor air quality in school buildings promotes learning, improves physical and mental health, increases productivity, reduces missed days and attrition, and offers a good return on investment. We can provide safer indoor air quality by following the basic guidances provided by the CDC, the EPA, and other environmental health specialists that were discussed today. Again, our program, the Mid-America Pediatric Environmental Health Specialty Unit, is located at Children's Mercy in Kansas City. We work hard to provide the most up-to-date guidance around maintaining healthy school environments during the pandemic and beyond. We would like to thank our staff, our partners, and funders for their support and involvement in pediatric and environmental health. This material was supported by the Environmental Protection Agency and the Agency for Toxic Substances and Disease Registry. We would also like to thank the American Academy of Pediatrics for their ongoing support. We do not endorse the purchase of any commercial products or services. We hope the information presented today was useful. Please consider visiting our website for additional resources, and don't hesitate to send us your questions or contact us via the Children's Mercy Schools portal or the MAPEHSU website.